Hi everyone, welcome to our channel, Canadian Nurse Expert. Today, we dive deep into a complex but highly important topic, Obsessive-Compulsive Disorder, better known as OCD. OCD affects millions worldwide, causing distress and impacting daily life. In this video, we'll explore its symptoms, causes, and treatments, providing a comprehensive understanding of this condition. Obsessive-Compulsive Disorder, or OCD, is a chronic mental health condition characterized by persistent, unwanted thoughts known as obsessions, and repetitive behaviors called compulsions. These obsessions and compulsions can be so severe that they interfere with daily activities, relationships, and overall well-being. For example, someone with OCD might feel compelled to wash their hands repeatedly to the point of causing skin damage, or they might check locks multiple times before feeling secure. OCD affects about 2 to 3% of the population, and it can manifest in various forms. Obsessions are unwanted, intrusive thoughts, images, or urges that repeatedly enter a person's mind. They cause significant anxiety or distress. Common examples include fear of contamination or germs, fear of harming oneself or others, obsessions with order, symmetry, or exactness, intrusive thoughts about taboo topics like violence or religion, repeated doubts such as whether doors are locked or appliances are turned off, excessive focus on religious or moral issues, fear of losing control and acting on an unwanted impulse. Even though the person often recognizes these thoughts as irrational, they feel powerless to control them. Obsessions are intrusive and unwanted, causing significant distress. They can lead to repetitive behaviors or mental acts aimed at reducing anxiety, but these actions only provide temporary relief. The cycle of obsession and compulsion can severely impact daily functioning and quality of life. Compulsions are repetitive behaviors or mental acts that someone feels driven to perform, often in response to an obsession or according to strict rules. Examples of compulsions include excessive hand-washing, repeated checking like checking doors or stoves, arranging objects until they feel just right, and repeating words or prayers silently. Other compulsions can include counting objects, tapping surfaces, or touching items in a specific order. Some people might avoid certain numbers, colors, or even cracks on the sidewalk to prevent bad things from happening. Rereading or rewriting, repeating actions, or redoing tasks until they feel right are also common compulsions. These actions are aimed at reducing the anxiety triggered by obsessions. However, the relief is only temporary, and the cycle soon begins again. The compulsions provide a short-term escape from the distress, but they reinforce the obsessions, making them stronger over time. This creates a vicious cycle where the individual feels compelled to perform the compulsions more frequently, perpetuating the disorder. OCD creates a vicious cycle: obsession, anxiety, compulsion, temporary relief, and then obsession again. This cycle can dominate daily life, making simple tasks feel overwhelming. Obsessions trigger intense anxiety, leading to compulsions aimed at reducing this distress. However, the relief is short-lived and the cycle starts anew, deeply impacting one's routine and mental well-being. Over time, these cycles can become incredibly disruptive, trapping a person in hours of rituals each day. This can severely impact daily life, making it difficult to maintain relationships, hold a job, or even leave the house. The constant anxiety and need for reassurance can lead to arguments with loved ones and feelings of isolation. OCD is the fourth most common psychiatric illness worldwide. It affects about 2 to 3% of the global population. It often begins in late childhood or early adulthood, with men typically having an earlier onset than women. Studies show that OCD is equally prevalent across different cultures and ethnicities. Obsessive-compulsive disorder affects people of all ages, including children, adults, and the elderly. It impacts both men and women equally in adulthood. Often, OCD co-occurs with other mental health disorders such as depression or anxiety, making it a complex condition to manage. Understanding the demographics can help in providing better support and treatment options for those affected. While the exact cause isn't fully understood, research points to a combination of factors: biological differences in brain structure and function. Studies show that certain areas of the brain may be overactive or underactive in people with OCD. Genetic family history increases the risk. Specific genes have been linked to OCD, suggesting a hereditary component. Environmental traumatic experiences or stressful life events may trigger onset. Childhood abuse, significant life changes, or chronic stress can contribute to the development of OCD. Neurochemical imbalances in brain chemicals like serotonin, dopamine, and glutamate are also implicated in OCD. OCD is diagnosed based on clinical interviews and criteria outlined in the DSM-5, specifically the presence of obsessions, compulsions, or both that are time-consuming, distressing, and interfere with daily life. The diagnostic process involves a detailed assessment of the individual's symptoms, including the frequency, intensity, and impact on their daily functioning. A thorough evaluation helps in formulating an effective treatment plan tailored to the individual's needs. Many people suffer in silence for years before seeking help. They may feel ashamed, misunderstood, or fear being judged. It's crucial to seek help and not face this alone. The good news: OCD is treatable. Treatment options include cognitive behavioral therapy, specifically a method called exposure and response prevention, where patients gradually face their fears without performing compulsions. Medications, primarily selective serotonin reuptake. Inhibitors like fluoxetine or sertraline. In severe cases, advanced options like deep brain stimulation may be considered. Group therapy and support groups can also be beneficial, providing a sense of community and shared experiences. Additionally, mindfulness practices can help manage symptoms by promoting relaxation and reducing stress. Digital tools and mobile apps are emerging as helpful resources for tracking progress and providing support between sessions. Recovery is a journey. Many individuals with OCD can lead full, meaningful, and productive lives with appropriate support, treatment, and coping strategies. Techniques like mindfulness, joining support groups, and maintaining a journal can be incredibly helpful. Remember, seeking professional help is crucial in managing OCD effectively. If you or someone you know is struggling, remember, help is available and healing is possible. Reach out to a mental health professional, call a helpline, or join a support group. There are numerous resources and people ready to assist you on your journey to recovery. Don't hesitate to seek the help you need. Your mental health is important and support is out there. Thanks for joining us today in understanding obsessive-compulsive disorder. Stay compassionate, stay informed. Remember, if you or someone you know is struggling with OCD, seek professional help. There are resources and support available. Stay strong and take care.